Good morning. I guess I have to speak very fast to make sure we don't fall too far behind. Good morning to all of you. Welcome. So welcome to our members, guests and friends, and those of you who are here today joining us by webcast. We have an outstanding program planned today with really many notable speakers, but particularly we're excited that Dr. Cory Bachman is our keynote. So please be sure to stick around for also the final session of the day, which is a President's Forum that will focus on the opioid epidemic with Governor Charlie Baker, Secretary Sebelius, Jerome Adams, Scott Gottlieb, and Steve Leibman. So I'm delighted to have the opportunity to open today's events by delivering my annual report as the President of the National Academy of Medicine. Before I begin, I would like to take the moment to acknowledge the past presidents of the NAM who are present: Harvey Feinberg, Sam Thier, wave, there's Sam, and David Hamburg. So I'm so pleased that you're with us. As the President of the National Academy of Medicine, it is a privilege to serve all of you and the nation. Indeed, I'm honored to be addressing you today. You know, 1 year ago, I stood before you reporting our progress in our first year as a full academy, and the last year's President's Forum, our distinguished panel, including Mark McClellan, Tom Dashiell, Mike Levitt, Risa Lavizzo-Mourey, and Larry Tabak, discuss the future directions of health and health policy in anticipation of the upcoming presidential election. Now, 1 year later, it is safe to say that since our election, our world has been full of surprises and unexpected developments. You know, the Chinese have a saying, may you live in interesting times. Well, we are living in interesting times indeed, often filled with uncertainty about the future. This uncertainty extends to development in health and medicine. I'm sure you're all too aware of the tumultuous attempts by Congress and most recently by the U.S. President to repeal and replace the Affordable Care Act. Indeed, the plans and actions of the new administration and Congress have raised significant questions about the future of our nation's health and health care, our investment in biomedical research, and the U.S. support for global health. These uncertainties have shaped much of NAM's activities in the last 6 months, and certainly has kept us and kept me very busy. As the nation's premier independent and trusted advisor for health and medicine, our work is more important than ever. As the Institute of Medicine and now the National Academy of Medicine, we are ready to serve the nation, just as we have for decades, regardless of which party is in power. We can and will continue to have real influence on the future of health and medicine in this country. How? By continuing to do what we have always done so well, provide independent, objective, and nonpartisan advice to policymakers and the public. Indeed, this is a foundation upon which our reputation is built, and this is why our voice carries real weight. The debate around the repeal of the Affordable Care Act is one such issue. There's a desperate need in our nation for a blueprint to build a better health system that controls costs and improve health outcomes while providing access for all. This is why we launched our Vital Directions for Health and Healthcare initiative. This nonpartisan, evidence-based effort addressing soaring healthcare costs, disparities in health, the burden of chronic diseases and disability, and other national challenges. We identified 3 core goals: better health and well-being, high-value health care, and strong science and technology. Informed by 19 policy papers addressing key issues in health and medicine that were written by 150 of the nation's leading experts, Vital Directions call for a nation to focus on the ultimate goal of improving health for all through an effective healthcare system, one that not only helps people to prevent and treat their ailments, but also helps every American reach their best health and well-being. Our publications capture significant public and private attention. We believe that the messages from Vital Directions could serve as important guideposts for members of Congress and White House as they debate the future directions of U.S. healthcare. Since March, we met with more than a dozen members of Congress in both parties, including Chair of the Senate Health Committee, House Minority Leader, and the former Secretary of HHS, as well as leaders of FDA, CDC, and others, to describe how these findings of Vital Directions could inform healthcare reform. In our discussion, we emphasized that as a nation, we must refocus on the fundamentals needed to improve health. We must ensure access to healthcare that is both high quality and affordable. Now, these conversations, though difficult, generally went quite well, and we'll continue pressing this message as Congress tackles this challenge, hopefully in a bipartisan manner moving forward. Another area that's important to the future of health medicine is investment in biomedical research. As you may recall, the administration's proposed 2018 budget slashed NIH funding by about a fifth, or $5.8 billion. Fortunately, Congress instead bolstered funding by $2 billion for the remainder of fiscal year 2017, and now it appears that NIH may receive a minor increase in 2018. This is an encouraging development. However, final outcomes are still far from certain, and our Academy will continue to reach out on this issue in coming months. In these challenging times, we must stay true to our mission and values. That means we must stand up for a crucial role of science and evidence in guiding policy decisions. There's no denying it. Research and evidence are under siege on many fronts. Let me put this simply. Science is not a political issue. In fact, science can and should unite us because its benefit belongs to everybody. Science improves human living, cures diseases, and keeps us healthy. It lifts nations out of poverty and helps us understand ourselves and each other. Science will predict the next hurricane and help design infrastructure that can withstand it. Science is sparking our children's imaginations and fueling our economy. Science is not and should not be an ideological issue. People's lives hang in the balance. Today, we must reaffirm NAM's commitment to science and evidence. It's an essential foundation for any policy affecting our lives and livelihoods. The national academies are in a unique position to take on the most controversial issues and provide society with reliable and effective solutions. More than ever, in this age of junk science and willful ignorance, even manipulation of hard-earned, hard-won scientific truths, we must remain dedicated to advance science and evidence and to defend it vigorously. I often refer to a quote from Albert Einstein engraved on the wall of the National Academy's Keck building, a daily reminder for me and my staff. And I quote, "The right to search for truth also implies a duty. One must not conceal any part of what one has recognized to be true." And I think those words really ring true, don't they? While trust in science and evidence begins to erode, the consequences can be dire. The anti-vaccine movement is a perfect example. Some parents, including some well-off, educated parents, mistakenly believe that vaccines cause autism or might otherwise somehow harm their children, even though we at the NAM and many other medical organizations have repeatedly debunked the junk science that fuel these concerns. Just look what happened in Minnesota, which reported 79 cases of measles in 2017, more cases than there were in the entire country last year. So it turns out that for a few years prior to this outbreak, anti-vaccine groups that falsely touted the link between vaccine and autism targeted a specific community and preyed on parents' fears by repeatedly handing out literature and speaking at community health meetings. As a result, many parents opted out of vaccination of their children, and the vaccination rate in this community in Minnesota dropped dramatically from 92% in 2004 to just 42% in 2014. This is really frustrating because we know without a doubt that such outbreaks are entirely preventable. We can't afford to go backwards, not on vaccines, not on any other issue that science has settled. We should also make our voices heard when evidence is being ignored or misrepresented. At a town hall meeting discussing repeal of the Affordable Care Act, a member of Congress said, and I quote, "Nobody dies because you don't have access to health care." This claim was widely criticized, and for good reason, because evidence says just the opposite. People do die when they don't have health coverage. One of our own IOM reports from 2002 found that approximately 18,000 Americans die each year because of lack of health insurance. New data suggests number may be as high as 45,000. All too often, in discussions of controversial issues, evidence is disregarded or cherry-picked to support one side or the other. You know, this happens frequently on different debates, for example, on immigration policy. I'm a proud American who's also a grateful immigrant, and I would also assume that most of you sitting in this room are either immigrants or descendants of immigrants. We're a nation of immigrants. If we want to strike the right balance on immigration policy, we need a new full examination of the evidence. Fortunately, a recent National Academy report provides a comprehensive assessment of the economic and fiscal impacts of immigration based on evidence derived from the last 20 years. While the short-term effects of immigration on government budgets are mixed and vary considerably across states and localities, the report finds that immigration brings long-term measurable benefits, including economic growth, innovation, entrepreneurship, with little to no long-term negative effects on the overall wages or employment of native-born workers. For these and so many other issues, science and evidence can, indeed, and must guide the debate. This is why NAM and its members, all of you, must speak up for science and evidence. In fact, as scientists, health professionals, and experts in our field, all of us share this responsibility. As NAM members, you are the flag bearers for science-based policy in health. We can and must share our knowledge with as many diverse audiences as possible. There's no other option if we want to continue building on the remarkable progress in health and medicine that we made in recent years. And that's why even more critical now that NAM's work is shared far and wide. Our report's initiatives will have little impact if policymakers and the public aren't aware of what we have to say. Shortly after we became an academy, I asked Laura DeStefano, Director of NAM Communications, to engage a consultant to develop a communication strategy for our academy. It could not be more timely. At the heart of our communication strategy is the understanding our audiences and involving them at every stage of our work, from conception to completion, and being sure that we invite them to be active participants and contributors rather than passive receptors of our messages. And we're making a major effort to engage groups beyond the usual suspects, particularly to build awareness of our work at community level and to communicate through new mediums. We are developing innovative programs at the national academies, such as America Ask, Science Answers, From Research to Reward, the Koshland Public Engagement Program, Culture of Health Community Art Show, and Knowledge Hubs for clinician well-being and the culture of health. An important area is the effective use of social media. We're making a concerted effort to ramp up our presence online. Nowadays, many more Americans are getting their news through Twitter, Facebook, and other social media channels. The National Academies have a combined Twitter following of well over 100,000, but we need a lot more. We need to be the trusted source and go-to place for issues related to science and evidence, so that when an issue like climate change, immigration, or vaccine safety enters the news, and then Twitter feeds Americans, we will tweet a quick and easily understood reminder of the evidence. At the NAM, we're in the process of hiring full-time employee dedicated to social media and other web outreach. We aim to be the same trusted voice to the American public as we are in the halls of Congress. Going forward, we need your help to develop our communication outreach. We're exploring strategies to equip NAM members, all of you, as ambassadors for our work in your own communities. So keep an eye out for more to come on this, and let me know if you would like to be more involved. So in these interesting times, it's crucial that NAM is proactive in taking on issues important to our nation and the world. As you know, the challenges facing society and health medicine are enormous. Our work must make a difference in the lives of people we serve. In this segment, I'd like to review our priorities using examples of work that we have taken on. We have identified 3 priorities for the Academy that have guided our work for the last 3 years. First, respond to critical and pressing issues. Second, advise the nation and the world on the future of health and healthcare. And third, lead and inspire for the future. First, the NAM and academies must provide guidance and leadership for the most critical, important societal issues concerning health and medicine. Well, it's hard to imagine a more pressing issue than the opioid crisis. The health community has an urgent responsibility to do its part to right the cause. So in July, the National Academies released a consensus study that lays out the regulatory strategies to counteract opioid overprescription and misuse. Indeed, the U.S. President has designated opioid epidemic as a national emergency. Just last month, we released an NAM special publication in collaboration with the National Governors Association, which outlines actions for care providers. I hope you join me and our distinguished guests later today at the President's Forum to explore this devastating epidemic in depth. The Governor of Massachusetts will be joining us, along with federal judge from Miami-Dade County, former Secretary of HHS, FDA Commissioner, and the Surgeon General for a dynamic discussion centered on practical evidence-based solutions and creating a coordinated policy response for the long term. At the NAM, we also must respond to critical issues in emerging areas of science and medicine. That's what we've done through our Human Gene Editing Initiative, which we launched together with the National Academy of Sciences, so as to provide leadership in this rapidly advancing area of research. Precise new editing technologies such as CRISPR have greatly expanded interest in genome editing research to improve human health. But they also raise concerns and present complex challenges, particularly about the possibility of modifying the human germline. We kicked off our initiative in 2015 with an international summit, which we co-hosted with the Chinese Academy of Sciences and the Royal Society. And in February 2017, released a comprehensive report under the leadership of co-chairs and NAM members Arthur Charo and Richard Hines, and they're here today, that provides guidance on science, ethics, and policy on this important research. Our initiative has sparked international dialogue on human gene editing research, and we are on ongoing discussion with the Chinese Academy of Sciences and Royal Society about how to continue this dialogue internationally. Also, this year, we began addressing another pressing issue in healthcare, the epidemic of clinician burnout, depression, and suicide. It is a serious, pervasive, and all too often overlooked or hidden problem. As many as 400 physicians commit suicide each year, double the suicide rate of the general U.S. population. You know, that's deeply disturbing to us as health professions, but even more so, consider the impact on patients and society. So to take this complex problem on, we launched an action collaborative on clinician well-being and resilience, co-chaired by Derek Kirsch and Tom Nasker and myself, to bring together representatives from professional organizations, healthcare centers, government, payers, technology vendors, and other stakeholders. 50 leading organizations such as AAMC, ACGME, AMA, and others serve as members of the core sponsoring group, and another 80 plus participate in our broader network. We're planning a set of collaborative activities grounded in evidence-based knowledge to first access and understand the underlying cause of clinician burnout and suicide, and two, advance the multifaceted solution that reverse these damaging and disturbing trends. So I think you'll agree that NAM is being proactive in responding to these and many other critical, urgent issues in health and medicine. A second priority of the Academy is to continue to advise the nation and the world on the future of health and healthcare. Earlier, I discussed the impact of our Vital Direction initiative, shaping health and healthcare priorities going forward. Another example is our Culture of Health program. We all know too well that individual health is shaped by economic and social factors, such as geography, poverty, structural racism, and many others. And it is our obligation to act. With generous support from the Robert Wood Johnson Foundation, this multi-year collaborative effort will identify strategies to create sustained conditions that support equitable good health for all Americans. We're working with stakeholders from multiple sectors and regions across the U.S. to impact policy, science, and practice to improve many of these social determinants of health. And in January, we released the first consensus report entitled Communities in Action, Pathways to Health Equity. The report focused on root cause of health inequity and laid out several specific approaches for communities to take in order to address this. We've also conducted a series of listening and learn meetings, touring around diverse communities across the United States to hear concerns, share strategies for improving health. We plan to undertake 2 more consent studies in this coming year. Our third priority is to lead and inspire the future. As the leading academy for health and medicine, we can galvanize the nation and the world and activate public-private engagement to tackle big problems that are of enormous importance to society. The grand challenge, if you will. Grand challenges are big, audacious goals that require visionary thinking and broad, sustained collaboration across disciplines, academia, industry, philanthropy, government, and the public. So our inaugural grand challenge in health and medicine is focused on healthy longevity. Do you know by 2050, people aged 65 or older will make up full 20% of the U.S. population. And the projections are even higher in some countries around the world, such as Japan. Without action, this could put a significant strain on economies, healthcare systems, and society around the world. We urgently need solutions from biomedical, behavioral, sociological research that keep us healthy, productive, functional, and free of disease as we age. With the right solutions and actions, healthy aging can become a major opportunity rather than a burden for society. The National Academy of Medicine's Grand Challenge on healthy longevity will have 2 components. First, we're considering a strategic, comprehensive global initiative called Global Roadmap for Healthy Longevity. This will provide an assessment of the challenges and opportunities presented by global aging. The roadmap, which is still under development, will consider issues and solutions pertaining to science and technology, community and social determinants, healthcare and social systems, practice and policy. Second, we plan to establish a program of Grand Challenge awards and prizes. This initiative, led by Bob Horwitz, Tachi Yamada, and others, will stimulate transformative science by inspiring biologists, engineers, social scientists, and others come together as teams to identify important breakthroughs that can mitigate, if not reverse, the degenerative effects of aging, and to develop technologies that will transform the lives of the elderly and significantly improve health span. It is our hope that this grand challenge will significantly advance science and medicine and mobilize public support awareness around this important common goal. A lot of issues I've touched on so far center around U.S. challenges, but let me be clear. Just as science and medicine are increasingly international endeavors, our Academy is more committed than ever to help guide policy, not only here in the U.S., but also around the globe. It is undeniable that the health and prosperity of any one nation, including our own, is very much dependent on the health and well-being of others. In our global economy, improving international health is essential for economic security and prosperity here in the U.S. At a time when the U.S. appears to be pulling away from international engagement, the national academies are playing a crucial role in providing much-needed leadership and guidance in this area. That's why a recently completed National Academy study is particularly timely. It makes a strong case for continued U.S. government investment in global health to maintain the success of our recent decades. 4 crucial priorities are laid out: pursuing global health security, addressing continuous communicable threats such as HIV, malaria, TB, and saving lives and improving the lives of women and children, and promoting cardiovascular health and preventing cancer. And reporter highlighted the way the global health is conducted needs to be reevaluated, and it cannot be business as usual. Improving global health access, affordability, and outcomes will require scientific and technological innovations, new and appropriate incentives to catalyze research and development, and diversification of sources and mechanisms of global health funding. The NAM is committed to ensuring this important report has lasting global reach. We published a special report in the New England Journal of Medicine just 2 weeks ago and a commentary in Lancet. We've organized dissemination meetings in conjunction with World Health Assembly in Geneva. We've met with key administration officials at White House and U.S. national security staff. We're planning a global health symposium later this week in Atlanta to further discussion on these issues. I've covered a lot of ground so far, but let me sum up by saying that all the work that we've done is really focused on the 3 major priorities I outlined in this slide. And we aim to make a difference. We aim to, in fact, serve our nation and globally. So, what's next for NAM? Now that we have established ourselves as an academy, we are looking to position ourselves for the future. Yes, we've accomplished a great deal in the past 2 years, and when you count our legacy as the Institute of Medicine, we're approaching 5 decades of service to the nation and the world. In 2020, we'll be celebrating our 50th anniversary. And how will we build upon this success going forward? What kind of future do we envision? And how do we get there? Many of you have been advising us on this issue lately. I've enjoyed hearing from your thoughts at the informal regional gatherings of the NA members. I'm exceedingly grateful to those who have volunteered your time and expertise as members of the Strategic Planning Committee. On Sunday, just yesterday, many of you heard our presentation at the business meeting on our strategic plan for the next 5 years. Simply put, our vision is a healthy future for everyone. We have developed a modified and new mission statement, and I'll read, to improve health for all by advancing science, accelerating health equity, and providing independent, authoritative, and trusted advice nationally and globally. In everything that we do, we will adhere to our core values: scientific excellence and rigor, objectivity and independence, and diversity, inclusion, and equity. Our mission statement and values will inform our work going forward and how we put this into practice. So how will we do that? First, as we already have discussed, we have to be proactive in taking on the most critical societal issues concerning health and medicine. Next, we want to increase the NAM's capacity for doing the work that we do. That means a significant investment in building the sustainable infrastructure with an engaged and diverse membership and staff who can implement the broad portfolio of work. And third, we need to be proactive in establishing a diverse membership for the future. I'd like to underscore this point. Diversity is not just a buzzword for this academy. It is a key element of our strategic plan. The NAM is committed to building a more diverse and inclusive membership, engaging younger and emerging leaders and scholars to be sure that we are prepared to address new challenges and evolving contexts. That is why we established the Emerging Leaders Forum to increase our engagement with exceptional early and mid-career professionals working in biomedical science, healthcare delivery, health policy, and related fields. These future leaders gain exposure to the Academy's activities and mentorship. In return, NAM is connected to a broader network of new energy and perspectives and provides a mechanism to learn what issues younger generations consider most critical. As I discussed earlier, we work hard to establish a strong global presence, and we can't stop here. We need to do more to increase our international engagement. Finally, we'll continuously monitor and evaluate our progress toward our mission. We are now forming working groups to establish plans for implementation of strategic plan, including setting benchmarks for measuring success and making adjustments as needed. I have no doubt that we're going to accomplish great things in years ahead with your help. We can't do it without you. We won't be here today without our incredible, talented, dedicated members and supporters. We'll need your ideas, your commitment, and your dedication. We need your expertise and enthusiasm. After all, we're all here today because we want to be part of something that's bigger than just ourselves. We all want to give back. Einstein also said, "Only life lived for others is a life worthwhile." I'm really convinced that together we can really improve health together for everyone. There's no pursuit more worthwhile than that. So thank you so much for indulging me in the last 30, 40 minutes, and I will move forward together, I'm certain, to a much greater future. Thank you.